One of the big questions that everybody hears all over the place is the cost of lockdown. Now, we know about the mental illness, we know about all these other issues, but you hear deaths actually caused by lockdown. Dr. Neil Rao is a medical doctor, an infectious disease specialist. He joins me right now because I understand from some doctors I've spoken to that the cancellation of operations, people are dying of cancer and all kinds of other diseases because COVID takes precedent. Is there somebody saying, you've got cancer, you're going to die, you've got COVID, we're going to try to save you?
Well,
Tell me it's not that simple.
Okay, well, that issue has been improved a bit in these more recent waves of lockdowns and curtailing of healthcare capacity. Yes. But there's no question that delays in diagnosis cause suffering. And for a while, we had people so spooked, they wouldn't even go to the doctor, especially wave 1 and wave 2. People were scared to go to the doctor. The only way I could pull some of those people out of their shell, my own patients, is if I could get them by phone or virtual care, but on FaceTime. But there are a lot of people who are lost to follow-up, didn't renew medications, let their chronic diseases just run without oversight, and that's bad. It doesn't always lead to death, but it can lead to bad outcomes. And there were some people with delayed diagnoses and delayed surgeries for cancer. I think some of it's been remedied during this current wave, to be fair, but the longer this goes on, the worse it could be. I think this is going to be a shorter lockdown, but it can be bad.
Why are operations delayed? The surgeons who are dealing with, who are surgeons operating, they aren't being transferred over to deal with somebody with COVID. They're just told you can't operate today. One person told me it's because the bureaucrats in hospitals say, we can't handle all this business.
I think part of what's going on is self-inflicted, not so much by bureaucrats, but by the fear of COVID in people who are healthy, like the healthcare workers,
right,
that they will bring it into the hospital and then give it to the patients.
So limit people going into hospitals?
Well, the idea is that if you control for people who are working in the healthcare system, test them, exclude them if they're positive, even if they don't have symptoms, that you'll prevent spread in the hospital. But the problem is the fire is burning in the community anyway. These people are coming from a place where the disease can be acquired in the community. If we said, listen, for people who are otherwise healthy, this is a minor illness, which I think we can all agree is the case when it comes to Omicron. How many of us haven't had it now or don't know someone who's had it? And we really just worried about people who are really sick with COVID coming into hospital, giving them the best care possible, and then letting the rest of the show of healthcare go on, we'd be better off. But we've excluded a lot of people from working because they're testing positive. And then we're trying to come up with strategies to reintroduce them sooner, but we're too slow off the mark with it. So we've created a healthcare staffing crisis. We don't have a problem where the hospitals are overwhelmed with sick patients from COVID. We have a shortage of staff to take care of a slight bump in the number of sick patients. So we've got a tsunami of people on furlough, people on off work, rather than a tsunami of cases right now.
Very thoughtful, well said. Thanks very much, Dr. Rao. 3 minutes. Thank you very, very much for watching and for engaging in the 3 minutes, which will carry you through most discussions for the day. 2022 is going to be a very, very tough year. Stay with us. Please tell your friends to subscribe and PayPal. Thanks.